ahead and introduce.
Okay. Well, first of all, Sarah Starnes is she's my friend. She's our friend. She attends South City Church, where I'm the senior pastor, and just a wonderful Christian sister. And that's kind of the main thing. She loves Jesus, and she loves the church. She's also a professor in the Department of Pathology, Pediatric and Prenatal Department over at St. Louis University Medical School. And and so when we were thinking, because we don't want to wear David Bell out, we're like, okay, let's see if we can get some help in here. And I just talked to Bishop and I said, hey, man, I got somebody who loves Jesus, knows medicine, and has helped me a lot in the past few years. So I'm going to present Dr. Starnes, but let me pray for her first. So let's pray. Father, thank you for loaning us people in this life who you have gifted, who you've given passion to, who are here to help their neighbor, help the church, and be a blessing. So we ask that you would be with Sarah as she speaks, help us to hear what she's saying. And Lord, I just pray you would use this to continue to help us worship. Please give our medical folk dominion over COVID-19 so we might have an ability to have vaccinations and stuff like that. And so we just thank you. Amen. All right, Sarah, you got it.
Just one. Right. I'm just going to let everybody know that I'll be muting you just so that we can, stay muted and Sarah can have the floor. If at some point she wants to open it up for asking questions, you'll need to unmute yourself on that. Okay, guys? Go ahead, Sarah. Sorry.
All right. Can you all hear me? Am I unmuted appropriately? All right. Thank you so much to Pastor Mike and Bishop Phil for asking me to do this. Thank you, Pastor Steve, and really all the members of the St. Louis Pastoral Fellowship. So in addition to what Mike, how he introduced me, which I couldn't ask for a better introduction, I also wanted to say that right now, most of my time is spent in a hospital laboratory, so a testing laboratory where, of course, we have ill patients who come in with all sorts of diseases, but especially right now, the numbers go up and down, but there's one patient in our hospital. It's in the Metro East. It's in Illinois. There's at least one patient that we have that we're treating for COVID-19. So, of course, a lot has changed over the past several months for how we test for that and how we treat for that. And that's some of what we'll be talking about today. So another point I want to mention really quick before we get into the meat of the discussion is where do I get my news? There's a lot of information out there. Of course, some of it, depending on your political stripe, you might get your news from one outlet or another. What I'm going to be sharing today really comes from two main sources. So one broad source is medical literature, and I guess I should also include in that the Illinois Department of Public Health, because my hospital that I'm primarily at is in Illinois. A lot of the information that we get on a daily basis comes from that state's public health department. A lot of the information is going to be very, very similar to what the Missouri Department of Public Health would put out. Some of the regulations are different, so we won't spend much time talking about those. But this is usually news about the virus that is very fresh within. It seemed in March and April, it was every couple hours there was some new information, but it's usually very, very up to date. The other big section, of where I get my news from for the purposes of this talk, is from the Christian Medical and Dental Association. So I'm a member of this group. And as Pastor Mike said, this group is made up of, if you're not familiar, it's medical and dental professionals who claim Jesus as Lord. And recently they had, I think they've been working on this document for a while, but they had, we had some of our specialists in public health put together a document that I agree with Mike, that these are folks who not only do they have some scientific and medical background, but it's very particular to worshiping communities, people who want to gather and worship the Lord together in person, and recommendations. So what I want to do today is hopefully under 20 minutes, try to talk about what we know now about virus. We're learning things every day, of course. A lot of this may be reviewed for those of you who really stay close to what's in the news. So what do we know now? Based on that, what are some recommendations for how folks can come together as safely as possible to worship our Lord together? I know some of you in this group, as you've already mentioned, have already reopened your sanctuaries and corporate worship, and maybe there are some recommendations where you might decide, oh, maybe we should tweak how we're doing things. For those who have not opened at all, this might give opportunity to think further about what it might look like to have everybody, or at least a portion of a congregation, back together. And then, so in addition to recommendations for church congregations, we'll look briefly at what should be, based on the medical trajectory, scientific trajectory, what should we anticipate in the future? We'll talk about what the vaccine means and how that changed how we worship. And then we'll definitely open up, after my time of talking, we'll open it up for questions and comments. So go ahead and, of course, be jotting notes or thinking about questions that you want to ask as we go on. There will be opportunity for that. So my purpose today is not to make anyone feel like, well, this is the only way that we can reopen safely. But I just want to give what I hope prayerfully is some unbiased medical information, really in spirit, speak truth in love to help your decision making as Christian pastors, ministry leaders. I mentioned in talking to Pastor Mike and Bishop Phil yesterday, and I want to say this up front. I do not envy any of you having to make these difficult decisions for your individual flocks, for your congregations. I think it's always difficult to be a leader in a church. And of course, you all are held to a very high standard. But right now, I think sometimes there's no right answer, especially when it comes to COVID-19 and maintaining ministry. So I just want you to know I'm praying for you all, and I really value how you lead us, and I pray that it's in a way that Jesus would want. Okay, so starting off very, very quickly, what do we know now about the coronavirus pandemic? Just very, very quick review. So of course, back in the late fall, we now think probably even earlier than December, November, there was a viral outbreak in China that quickly spread all over the world, probably spread to the US at that time too, based on some autopsy information that we have that's coming out from folks who died in California in the late fall that tested positive for coronavirus way after the fact. The disease manifestation, as I know Pastor or Bishop Phil already talked about, of course, some of the folks in his congregation who are very, very ill. But the most common symptoms are what we call a flu-like illness, which is fever, cough, difficulty breathing, and generally, if you've ever had influenza, you just don't feel good. Fatigue, weakness. There are some patients, it's important to say, there are some folks who they may not have a fever, but they might have symptoms more of their gastrointestinal distress. So they may only present with diarrhea, cramping. And so those, as medical providers, we're always on the lookout for, could this person be presenting with symptoms that are not typical? And finally, and this may be one of the most important and unique features of this new coronavirus, there are, as I know you all know, there are many people who contract the virus and have no symptoms at all. That's very unusual for any respiratory virus, especially a coronavirus. Most people, for instance, who contract influenza, they know it right away. They have symptoms, but this coronavirus is unique in that it often doesn't have symptoms, and it's also what makes transmission of it so difficult to control. So we will come back to that later. Risk factors for why someone might get really, really ill and someone else might basically feel like they had a cold and then it went away. So I want to touch on this. This, again, probably a review for a lot of you. Some people say that age is just a number when it comes to coronavirus, but at the same time, folks who are older than age 60 or 65 tend to have conditions that predispose to a very severe course of illness. So what are some of those? Mostly they are heart disease, acquired heart disease like coronary artery disease, heart failure, also lung disease, respiratory disease. So folks who have chronic obstructive pulmonary disease, difficulty breathing. It's also important to put in this category moderate to severe asthma. So, often we think of older people being severely affected, but even young people with severe asthma, they can be at increased risk of a severe course of illness. There are others as well, lots of other risk factors. And actually, I'll mention this right now, the document that Pastor Mike kindly, graciously is going to send out from the Christian Medical and Dental Association, it lists in very specific detail risk factors. So if you or your family members, or if you know of folks in the congregation have these, just to keep that in the back of your mind. So how does this spread? So we've talked about this new coronavirus that, unlike, I didn't mention this yet, unlike other coronaviruses, which normally just cause the common cold, this can produce very severe disease and death, but can be asymptomatic. So how does it spread? This is an area that our thinking has changed dramatically just since March, just a few months ago. So what we know now is that it seems to spread the most effectively as tiny airborne particles. So mostly this is respiratory transmission. It's mostly folks who are breathing in these particles or perhaps taking them in by mouth, so some oral spread. How does one encounter these tiny particles? Usually they're close to other people for prolonged periods of time. So that increases the amount of particles of the coronavirus, the virions, in a little pocket of air, enough to transmit the virus. We used to be worried more so about contaminated surfaces, handling of objects. Could coronavirus travel in the water? We think right now, of course this could change, but right now, based on some evidence, there's a low likelihood of this. So is it good to wipe down your pews or clean doorknobs? That's a very good thing. But the thinking is that this is an unusual way that someone would contract the virus, that it's more about being close to people and sharing that same breathing space. So based on this, seriousness of this virus and how it spreads, we're going to talk now about recommendations for churches, for congregations. So with all this in mind, what should we do best to protect one another, protect the folks in our congregations? The simplest thing that I would say first is a lot of us medical people, we get into the weeds, we look at the data, but I want to encourage you all with the reminder that the church has always been doing the same thing, and in some way here should do no different, which is number one, pray for each other, pray for the folks in your congregations. Because we understand, you all more than anyone understand the power of prayer. The prayer of a righteous person is powerful and effective. And then secondly, so that's number one. Number two, attending to the needs, the physical earth needs of your congregation, the acts of mercy. Who needs food because they've been out of work? Who is homebound. We'll talk more about homebound populations in a moment, and some ideas, but who needs attention and who couldn't get perhaps maybe a congregation member who doesn't have internet access and maybe can't join a Zoom service, but also has difficulty getting out. How do we take care of them? So it's things, there's nothing new under the sun. Even in this crisis, that's what the church is called to do, I think, number one. But number two, in this very particular instance with this virus, some other general recommendations. So I would say for everybody across the board, just about every age group, unless you're a toddler under age 2, the 3 W's. I don't know if you've heard it put as the 3 W's. I think it's a handy way to remember it. So number one, wear a mask. So that keeps 2 things we've learned about mask wearing. That keeps you, if you have an asymptomatic infection, it keeps you from spreading those infectious particles to the people around you. So it's really, it's an act of love to the people around you to wear that mask. But second, we have learned very recently, as is intuitive, the mask does protect you some as well. Even a cloth mask, when worn properly, does offer some protection from the virus coming in to your air passages. So that's the first W, wear a mask. Number 2, watch your distance, okay? So you may have heard of social distancing. Some people don't like that term because they say, no, we should be physically distanced, but socially together. 6 feet is the magic number. That's on that's due to expert opinion. That's still something that's being studied. But we know that a lot of the outbreaks that have happened around the world in churches specifically, in places like France, South Korea, it's when people they spend a lot of time really close together, like we were used to doing in church, to be honest. But yes, watch your distance. And the third W, wash your hands. Even though we do think the risk of transmission is relatively low from surfaces and objects, there's still that possibility when you come into contact with someone who has an infection that you could transfer that to your mouth. So the same thing that you might teach your young children or the children in your life, be sure to wash your hands. Or to have hand sanitizer nearby, that's going to be very, very, very helpful. So those are the 3 W's for everybody that I would recommend in any size gathering. If someone has a Sunday school class or a Bible study in someone's home, if just abiding by these 3 W's is going to be really helpful in reducing spread. The other one that's come about more recently, I'd say the past couple months, is we've learned how beneficial outdoor activities are. So anything that can be moved outside, that's also going to drop the risk of transmission. I know at church in the neighborhood where I live right now, they have just restarted as church on the lawn. So I know, of course, that's subject to weather, but that's one way to really think about having as much of the congregation as possible, but having them outside as to really reduce that risk. So specific recommendations for formal worship, and there's more data, a lot more evidence that's described on these particular recommendations in that PDF document that Mike will be sending you. But just to touch on some of them here, things like the Lord's Supper, baptism, singing, and singing in a choir. The Lord's Supper recommendation right now that has the least amount of risk is prepackaged communion. For baptism, right now the recommendation that has the least amount of risk is to baptize with fresh water, with clean water, or if there are serial baptisms in the same font and the same baptistry, to try to have that water heated above room temperature. That seems to kill the virus as far as we can tell right now. And finally, a word on singing, choral singing, even congregational singing. Just like talking tends to put out viral particles, singing does as well. And in addition to just your mouth is open and you're breathing and you're spreading viral particles, singing is forceful, right? You want to, if you've ever been in a church choir, you're told, make sure the last person in the last pew can hear you. So you are forcefully spreading those tiny, possibly viral particles by singing. So the recommendation is, if you're going to sing, either do so continuing to wear your mask, or to have maybe one person who's very far distanced from the congregation. Maybe they're in another room, maybe they have a microphone and can be kind of spread away. I know not everyone has access to things like microphones, but that's another way to keep viral spread down while still having choral singing at church. So here's another question for formal worship. Contact tracing. What does it look like to have contact tracing in your church service? So contact tracing, as a reminder, is keeping track of people that if they get sick, you know, they were in contact with Mr. X and Mrs. Y, and then you can make sure to let them know that they need to quarantine for a little while, stay put. So a couple things that I've seen about contact tracing at church, and again, you all may be familiar with this already. One is to have a sign-in sheet. So especially for visitors, that you have maybe a phone number for them. What's the best way to contact them in case someone in the church tests positive on that after having been at a particular worship service on a particular day. Another option that can be instead of or in addition to the having the sign-in sheet is to track where people are sitting inside of the sanctuary. Let's say if you're having it inside, and to say, oh, well, we know that the Williams family always sits in that second pew, and we're going to ask them to remain for the next several weeks. Just stay sitting in that pew. So again, if somebody gets sick, we know who's sitting all around them. So that's another way to do it, is almost like assigned seating. So a couple quick points on particular populations in our congregations. One is the particularly vulnerable. So the folks who have, let's say, more than one risk factor, they're older, Often, but not always, these folks are homebound anyway. They have difficulty getting around. So the question is, how do we best involve them in worship while still protecting them? I know this looks different in different congregations, but maybe a home visit from elders or bishops to offer communion while working with those folks. Maybe having a time where they can be transported to the church in a safe manner, or having a separate service just for them. These are all options that have been proposed. Children, another big population that are very particular, that are worth talking about right now for our purposes, in part because the information on coronavirus and children has changed rapidly, I would say, just within the past 2 or 3 weeks. So at the beginning of the outbreak, what you may have heard a lot of people say, I even said this, was right now we don't have evidence that children transmit it very well, especially under about age 10 or under age 5. We don't know. Is it because they're immune? Is it just the virus sort of passes them by? Very, very recently, so again, just the past couple weeks, we've learned that not only can children carry the virus, even though they may not show a lot of symptoms, but children younger than age 5 sometimes can have 3 to 10 times the amount of virus that they are carrying in their respiratory tract compared to, let's say, an adult over age 20. So they definitely can carry the virus. We also know that children, especially above age 10, like teenagers, preteens, they can get sick in the same way that adults can. You may have heard about that outbreak at the summer camp in Georgia very recently, where half of all the campers, there were hundreds that were there, got sick. So what to do with your children? We're getting ready to go back to school. There's a lot of discussion about, decisions of individual families. Do we homeschool? Do we send them to school? I would say, number one, just like the church has always done, pray over your children or the children in your lives for protection of the virus. Practically, because very young children, it's hard for them to understand that they need to stay apart from their friends. Children under age 2 should not right now be wearing a mask, but try to keep them isolated. So just with just like 1 or 2 friends that they see, that might be difficult to do as school opens up, but really teaching them about hand washing and trying to keep them isolated is the strongest recommendation we have right now. So what's next in the future? So here's where we're at now. We've got the virus. We have a resurgence in the United States. In some places, it never really went away. I would encourage us all, as Pastor Mike said, to pray for dominion over this virus. Pray for more therapies. We're developing new ones, or looking at old therapies. There's a steroid that we're giving to folks that it's been around for 80 years, dexamethasone. That seems to be helpful. So please continue to pray for therapies. Let's talk about a vaccine for just a moment. So if almost any secular news outlet, it seems to me that the vaccine is going to be the magic pill. The vaccine is going to change everything. And I think to quote you, Phil, from recent conversation, it's going to be, we're going to get a vaccine and poof, everybody's back in church. It's just like normal. It's just like old times. But I would take the liberty of saying that if the psalmist who wrote Psalm 20 were alive today, he, maybe she, would say, some put their trust in chariots, some in vaccines, but we put our trust in the name of the Lord. So a vaccine is not the be-all, end-all. For myself, I learned that medicine and healthcare, I was treating it like an idol, right next to our Lord, to say like, oh, well, if we can just treat the coronavirus, then we're all good. But remember, the Lord still has ultimate dominion, ultimate sovereignty over this. So practically, when a vaccine comes, there are three considerations. One, is it even going to work? This is very disheartening news to share with you all that you may know. There has never been a successful coronavirus vaccine. Lots of coronaviruses, never been a successful vaccine because people, as you may know, still get the common cold, adenoviruses, coronaviruses. So number one, there's a lot of optimism, but there's never been a successful one. Number two, availability. Let's say, we've got one that's successful. What you may have heard, we would need millions and millions, billions of doses around the world. That's going to take a long time to develop. And finally, the third issue with the vaccine is risk. So vaccines are often in development for years, not because it takes them a while to work, but it takes scientists a while to decide that the vaccine is not going to hurt the patients that they give it to. So there are a lot of side effects from some vaccines that they have to kind of winnow out those side effects before they bring it to market. So I will not be the first in line for a coronavirus vaccine, even though I think it's very, very important, but we won't know the risks for a while. So that's what I have for you. So we've talked about what we know now, some about specific recommendations for different populations inside the church and for formal congregational worship. And then looking a little bit ahead at what's next, what can we anticipate, vaccines in particular. But I just want to encourage you all that King Jesus is still in charge. There is nothing new to him. He knew this was going to happen. Still, though, the Lord asks us to call out to him, to bring all of our anxieties before him, lay them at his feet. And so I want to encourage you all that you are the ones, of course, to lead us, to lead God's people in our response to this virus. So thank you so much for your time. And I'd like to open it up to comments and questions.
Killed it, Sarah. Good.
Yeah, excellent. Great job. And yeah, if you have any questions for Dr. Sarah, just feel free to unmute yourself and ask her the question, and then we'll mute you again. So.
Maybe some folks' coffee isn't working yet.
Or maybe you were just so thorough.
Yeah, I think that's
answered all the questions. I mean, you did an excellent job. That was very good, very good.
Yeah. And that PDF, Rob, I sent it to you.
Yeah.
And, I'm gonna be circulating that to folk who are outside of the fellowship also, because I think that. And Sarah, I just want to say the way that you keep reminding us of who is the sovereign Lord, it's either all science or it's all Jesus, instead of it being Jesus is above and everything is under his dominion. And thank you for what you said. I never thought about the vaccine. I'm like, man, you just pull into McDonald's, you get a Big Mac and a vaccine, and you're okay.
Right.
So that you educated me.
Thank you.
I have a comment I would like to make. I enjoyed your talk. You pointed out some situations that's prevalent right now. First of all, Jesus Christ is Lord over everything, in everything, but he's also given us a mind to discern what's right and what's true. And you talked about, how information is disseminated to the masses. You can get the wrong information from the wrong sources. And many of those sources will lead you down the path and you will contract the virus. But I like the idea that you said, being out in the open air, so to speak, that is a way to, spread a message, where you don't have people compacted in small places where they are interchanging, particles from mouth to mouth, breath to breath. So it's something to consider and keep in the forefront of our mind. Hand washing, face covering, social distancing, and just caring about one another and looking out for one another. So I thank you.
Thank you. I think just a quick word. I think often it's easy to do to think, well, I'm an American citizen, and I have a right to not wear a mask, and I have rights. But I think for myself, as a Christian, if I'm not loving the folks around me, then my witness is going to be really diluted. And so if I can love the people around me by wearing a mask and giving up my right to not wear a mask, I think for myself, that's the message that I want to send of loving the folks around me. But I know still masks can be a political issue.
Hello?
All right, I was trying to unmute it. Okay, can you guys hear me now?
Yeah.
First of all, you did an awesome job. That's what me and my wife was just saying. You didn't have as many questions because you covered so many things so well. As Pastor Washington was saying about the outside services, let it be known that even during the outside services, we still need to wear a mask. So we want to reiterate that you do need masks. One of the questions I did want to ask, a lot of times we hear a lot about drinking the hot liquids. And I just be realistic. Sometimes when I talk to people, and even with the mask on, I go and drink some hot water or hot coffee. Why do they say that you should drink hot liquids and so on and so forth? I hear different things about sometimes when you breathe it in, it's in your system. And if you drink something hot, it'll go down to your stomach and that kills it, and so on and so forth. But what can you tell us about people saying that you should drink hot liquids?
So thank you for that question. The question is, if you are worried you're going to be transmitting the virus and you drink some hot liquids, hot coffee, hot tea, hot water, does that help keep your possible spreading of virus? Does that keep it down? So I think in speaking to that, there's nothing to back that up, but it doesn't hurt. Okay, so like with a lot of things, there's a logic to it, a physiologic logic, that's funny to say, where what we talk about, the virus does not appear to survive, very few viruses do, in liquid that's hotter than room temperature. So the thing is, I think not so much one is washing away the virus, but more that elevated temperature is helping to neutralize or kill those viral particles. Do we have proof of this? We don't. Does it make sense from one standpoint? It does. I don't think that hurts anything. I hope that answers your question, Bishop Phil.
Yes, it does. Another question that we have, a lot of churches are open, and that's fine. They know their congregations. But it's another thing that we as pastors are spending a lot of money on. I don't know, David, you still on here too, David Bell, you guys who could help with this. What people are doing now, first of all, I want to tell all the pastors, watch out, because there are people that are running around taking advantage of this situation, asking you for thousands of dollars to clean your church. So be careful about that. So between you guys, is that you just told us that the risk of catching it on contact is not as severe as we thought, but it's still good to clean everything down. I've heard that you can use stuff like peroxide and water to even clean. But the question I was asked, they're selling these very expensive, like humidifiers that you put liquid in that's supposed to put a mist in the air and kill the coronavirus. What do you guys know about that?
Also, excellent question. There are a lot of folks who, as you mentioned, Bishop, there's a lot of folks who are, I would say, some have good intentions, but
Right.
they are seeking to profit, some from fear of the virus, some from theories that haven't been proven, but kind of like the hot liquid, they figure, oh, this can't hurt, and we'll charge some money at the same time. Specifically, what I would say to some of those is it's going to be up to the church for let's say looking at cleaning, having a deep clean of the whole church. It's up to the church to decide, of course, whether they want to go down that road. But as soon as you bring people in, the risk is going to be increased again, especially if you're looking at airborne particles, bits of virus in the air. The humidifier bit, that there have, depending on which kind you're talking about, a lot of those, there are scientists who believe they are not effective. Putting out a solution into the air is not effective. Now that's a little different than the surgical grade equipment that I know some very small, let's say workout facilities are renting surgical equipment that might be in an operating room to help filter particles, like a HEPA filter. Trying to remove particles has a little bit more evidence than the things that I've seen of, oh, we're going to spray this mist and it's going to neutralize the virus. There's no evidence that we have right now that those work. As far as my own opinion, this is just my opinion about should a congregation pay to have a building completely wiped down and deep cleaned. I don't think that may be worth the money at this point in time. If that money would otherwise be spent, let's say, buying masks for folks who can't afford one when they come in the door. I think there are more effective ways to try to prevent the spread than a full-on deep clean. Having said that, the things that people touch all the time, just a wipe down of doorknobs, that could be useful. And as you mentioned, Bishop, also, it can be peroxide. It can be a simple solution of, is it vinegar and baking soda? But something really just to reduce the viral burden from those surfaces. And again, the likelihood of transmission, we just think now, is so low from those sites. And so just having folks, even if they're touching things, but they come in and you offer them hand sanitizer or some other way to wash hands after they've touched those surfaces, that seems to be very effective.
Okay, thank you. We really needed to hear that also about the spraying. Another thing that me and several of the pastors are talking about, if your church is open and you have a congregation in, you're doing the hand sanitizers, you're doing the masks, you're being extremely careful, you're practicing social distancing. I saw on TV yesterday that they even got companies that are making plexiglass screens to put on each pew to separate people. But one of the other things that we were talking about is if, say, you're in service on Sunday. Now, most people do their Bible studies online. You're not going to be in church again until next Sunday. What's the life of, if the low chance that it is contracted by touching something, wouldn't it be dead by 6-7 days, by 5 or 6 days on the surface? That's what I'm talking about with a lot of the advanced cleaning and stuff. What's the expectancy of how many days would it be on something? Do we know that?
That's an excellent question, Bishop. So the question again is, let's say you're not using your church building for a week at a time or some amount of time, and there is coronavirus that has landed and no one does anything about it, doesn't clean it, what's going to happen to that? So there are some studies that have detected coronavirus on surfaces for hours or days. Having said that, not all of those studies have looked at, is that virus still alive, so to speak? Could the virus, even though they've still found traces of it there, would it still be an effective way to communicate the disease, to transmit the disease? We don't know. We don't know. Another perk to worshiping in God's creation outside is that we know that the virus is easy to kill. Sunlight can kill this virus on a surface, sometimes within half an hour. So that's another reason, if you're able to move activities of any kind with your congregation outside. So we do know, to answer your question, Bishop, it can stick around for a while on surfaces, but we don't know, is that virus still effective a week later to actually cause disease? We just don't know yet.
Hey, Sarah, Renee wanted me to ask about the face shields, the eyes. Does this mean, because I mean, you know, we're covering everything, but you know, our eyes aren't covered.
Yeah.
So
Excellent question. So what's the deal with the eyes? Can there be viral transmission through what's called the ocular mucosa? The answer is yes. So much so now that in my hospital in the state of Illinois, and now in Missouri as well, if you're in a hospital, folks are treating you, healthcare workers, they should be not just in a mask that covers their nose and mouth completely, they should also be in a face shield, because there is a small but definite risk of the virus entering someone's body through their eyes. Having said that, in a hospital, the thinking is the virus is going to be a lot more concentrated. Do we have enough information to recommend face shields on top of a mask for people out in public? Right now, I would say we don't have that evidence. We don't have that information. But also, if people are able to watch their distance, one of the W's, that's not always possible in a hospital. You have a healthcare worker who has to get very, very close to a patient. So that face shield becomes very, very important. But if you're able to watch your distance, at this point in time, we're not as worried about transmission through the eyes. But that's a great question.
all right. Bishop Robinson, are you trying to?
Yes, I am. Excellent talk, Sister Sarah. I just want to thank you for that.
Thank you,
With all
sir.
that information, that was great. I want to get back to the thing that you were talking about the hot stuff and being transmitting something to someone else. Now, I just got over it. I was dealing with it for about 3 weeks. Okay. And I didn't give any thought about the transmitting it to anybody because I kept myself away from everybody. But what did give me relief was the drinking of the hot fluids and the breathing the hot air. Now, as far as a relief part of it, that gave me a whole lot of relief. And I didn't know I had to go out to my car one day, and it was very hot. And I sat in that car, and I that was the best breathing I had in a lot of days. When I sat in that car, I did not want to get out. So that gave me a lot of relief. Now, as far as spreading it or anything, you know, I didn't know about that part, about the heat and all that kind of stuff. But as far as the relief, that gave me a lot of relief, and breathing the hot air and the steam and the drinking of the hot liquids, there was a lot of relief that came. I just wanted to share that.
Thank you for sharing that. I appreciate that very much. So what coronavirus has in common with other respiratory infectious diseases like influenza, the common cold, even some bacterial infections like strep throat, as you mentioned, warm liquid, whether it's humid air or a warm drink, it's very soothing on the lining of your respiratory tract and your esophagus as well, to really soothe those tissues that have been injured. So I'm glad that brought you relief, very much so.
I have a comment that I would like to make, and I want to ask you about it. I know I deal with people that are in and out of the hospital settings, our heroes, so to speak. And one of the first things to do, they propose is to, when you come into your home, to take off your shoes and those clothes that you had on at work and get them washed, take a shower, wash your hair. What do you think about all that?
So definitely, thank you for the question. So we didn't talk much about it here, the specifics of if someone works in a healthcare setting, if they're in a doctor's office, if they work at the hospital, even if, truly, even if someone works in a hospital, but they are not providing patient care, let's say someone works as a custodian or they work as a secretary for a portion of the hospital, it is very important, especially if someone works in an area where there are a lot of patients who we know have COVID-19. At the hospital where I work, for instance, there's a whole wing of the hospital where we keep the patients who have had tests that detected the virus. We put them in that wing to try to keep the virus, as much as possible, not really completely possible, but keep it restricted to that area. And yes, so folks who come and go in those environments, we do recommend when they get home to really take everything that was exposed, the clothing, and wash themselves. Just like I mentioned that we thought surface and objects could be potent means of transmitting the virus. We thought that a lot more a few months back, and that's where a lot of those recommendations came from, because we didn't know how well the virus could be transmitted through surfaces like that. Now we think it's very, very unlikely to get it from contaminated clothing. Even if you were around a patient that had COVID-19, if just being near them, they got some viral particles on your clothes, it would be very difficult for you to get it just from the clothing. It's more physical contact with those patients, and again, the oral and respiratory spread, but it doesn't hurt for people in those situations who work in those environments.
Amen. Sarah, I just want to say thank you. You preached a really good medical sermon. Amen. Yes, you did. And
Thank you. That means a lot coming from you.
So hearing from you and folks like
Well,
David Bell and, folk who know what they're talking about, it really helps us. Now go ahead. What were you saying?
Oh, I really pray that the information that we talked about today, that the Lord is able to use that in some of your congregations as you make decisions to try to help determine what is the best course for your flock, your portion of Jesus's bigger flock, and how to best both take care of your people from the medical standpoint, but also from the spiritual standpoint. because we do. I confess, I can't wait to be in church again. I miss that. I took it for granted, and I know that now. But yet, I pray that you all gain wisdom from the Lord and how to lead through this pandemic, and just the decisions that you're going to be making for your congregations.
Amen. Every so often I'll ask Sarah, I was like, I'm the pastor of the church, right? I just want to make sure she knows that, because I look at folk in my church, and I'm sure you do too, people who are so gifted and knowledgeable, who have so much joy. And I'm like, it's an honor to be able to pastor the flock of God. And I know we all got people in our congregations like that. And just, Sarah, you bring our family joy. So, so I'm gonna turn it back over to Stovall or Bishop. And Sarah, if you need to go, fine, but you're welcome to stay. And we're making you a member of the St. Louis Pastors Fellowship right now. Already voted, secret vote. That's what happened. So, amen.